Well, an unprecedented fifth case of the dengue virus has been confirmed in LA County. Health officials say all of these patients got the virus here in Los Angeles. They didn't travel abroad. For more on this, let's bring in Fox 11 medical contributor Dr. Michael Daignault. Good to have you.
Thank you.
Did I say it wrong? Dr. Michael Daignault, talking about dengue fever. Let's start with the symptoms.
Yeah, so typical symptoms include, they're very flu-like, so you're gonna have fever, chills, joint pain, in some cases excessive amount of bleeding, but usually it's more flu-like in most cases.
Okay, why, I mean, as mentioned, people aren't traveling abroad to get this, so why are we seeing this local transmission?
So this is typically a disease of Central and South America, but as the climate change, the globe warms up, we're seeing the mosquitoes expand their range of operation to include most of the country and now Southern California. So it's not surprising that we're seeing this.
Okay, and how is this treated?
So there's no specific treatment. It's supportive care. We want to make sure in worst case scenario that people don't end up with end organ damage or sepsis or things like that. So the treatment is, Tylenol, ibuprofen for fever, body aches, and IV fluid to make sure you're properly hydrated, just to keep a close eye on you for the most part.
Okay, and how do you prevent infection?
So it's really important, if you're going to go outside, to wear long sleeves, mosquito repellent, and everybody should look around their property and make sure there's no standing pots of water or things like that, because everybody can do their part to eliminate the breeding grounds of these mosquitoes, and so that's the best thing you can do.
And how does one get tested? If you have these flu-like symptoms, how do you know, flu or dengue?
Right, and the other thing I was thinking about is West Nile virus, which is also mosquito-borne. So if you've been bitten multiple times and your symptoms just don't seem to be typical and they're lasting for a long period of time and you feel very sick, that's when you need to get checked out. And we have specific tests, but they have to be run to the Department of Public Health. It's not something we commonly test for.
Okay, one thing that you're seeing big time in the ER is having to do with people not necessarily knowing how to do the life-saving care like CPR. So you wanted to make a specific point tonight. Yeah,
and so a lot of people don't know that since 2008, the American Hospital Association, which controls, how we do CPR and the guidelines, has said we don't want people to do mouth-to-mouth resuscitation anymore because people weren't doing it right. A lot of time when they would give those rescue breaths, they would go into the stomach and not into the lungs, and it takes too much of a pause away from the compressions. The compressions are the most important thing. So a lot of times in the ER, patients are brought in by paramedics, and they'll say, oh, family started CPR, but we want to make sure if you're doing CPR, you check, there's no pulse, to continue the compressions only, because it takes a certain amount of time of consistent compressions to get to that level of perfusion to the important organs. And so when you stop CPR to give a breath, that perfusion drops off. And so it takes another couple rounds to build up again. So just compressions only for the general public.
Okay, so talk more, I should have led with what are you seeing as it relates to this issue of life-saving care?
Right, so exactly that. And so a lot of times when I hear that, people started CPR on scene, and you always want to find out, were they doing continuous CPR? Because as we say, time is heart, time is brain for us in the ER. And the CPR was started immediately. It was just consistent compressions until the paramedics arrived. That bodes so much more for your family member or friend that you started CPR on.
I would imagine that you think then that when you are trained for this, that they should make note of this in the training.
They are currently, right. And so that's the thing. But, one important point to make is TV and movies are not really helping us with this, because a lot of times, even to this day, you see the rescue breaths being given, out in the community on the show. So
how often does one need to get recertified?
I'm not sure. So if you go to AHA website, you can check for classes in your area. There's so many potential opportunities for everybody to learn CPR. It's super important. It's
been so many years for me. I'm definitely outdated, so I need to look into that. A good reminder for all of us. So if you at home, you would like to ask Dr. Michael Daignault a question, you can send him an email. You can send that email to askthedoctor@fox.com. You can find him on social media. We'll get your question on the air and answered by him on the air next time he joins us. It's a weekly thing. Okay.
Thank you.
Thanks for being here.